Dear learners, in this lecture you will learn about the basics of exposure, risk and vulnerability. Myself Dr. Netranand Sahu, Department of Geography, Delhi School of Economics, University of Delhi. Here you will deal with like how this risk vulnerability we can have like in different areas. So learning outcomes from the discussion on basics of health exposure and vulnerability. So understanding the health exposures like types of exposures, then we have health outcomes of exposures, then pathways of exposures and indicators of health exposures, vulnerability of health exposures, assessment of vulnerability, and then mitigation and prevention strategy, and within this learners will learn all these above said factors. Let us start this lecture with introduction. Like health exposures refers to the contact and interactions of an individual with various physical, chemical, biological or social agents that may influence their health, and these exposures can occur in various environmental including the home, workplace, community and even global, and they have some both immediate and long term effects on health. Okay. So, like understanding health exposures is crucial for preventing disease and promoting public health. And physical exposures, like definitions of physical exposures, or physical exposures involve contact with physical agents like radiations, noise, temperature extremes and mechanical forces. For example, radiations, exposure to ionizing radiations from medical procedures like X-ray or maybe environmental like sources, for example radon gas, and noise like chronic exposure to high noise levels in the workplace such as factories, it can lead to hearing loss. So then temperature, for example another extremes, temperature extremes, prolonged exposure to extreme heat or cold can result in heat stroke or hypothermia. Then chemical exposures, like let us have a definition of chemical exposure. Like chemical exposures involves contact with toxic substances including like pollutants, heavy metals and also industrial chemicals. Examples are like air pollutants, exposure to the airborne pollutants like particulate matter, PM 2.5, sulfur dioxide, and then we have carbon monoxides can cause respiratory and cardiovascular diseases. Then we have pesticides of agriculture workers, like exposed to pesticides may face risk of neurotoxicity or cancer. Then heavy metals, exposure to lead or mercury can result in neurodevelopmental issues, especially in children. So then biological exposures, like we have for example definitions of biological exposures. Biological exposures involves contact with living organisms including bacteria, virus, fungi and parasites that can cause infections or trigger immune response. And examples are like pathogens, exposure to the pathogens like the influenza virus, tuberculosis bacteria or HIV can result in infection disease. Then allergens, like exposure to allergens like pollens and dust mites or maybe animal dander can trigger allergic reactions or asthma. Okay. And then we have also socio-economic exposures, like within socio-economic exposures can relate to like how the socio-economic exposures can be like be different types of economic conditions that affect the health such as poverty, education, employment and access to health care. And examples we have like poverty. Individuals in poverty may face increased exposure to unsafe housing and malnutrition and lack of access to health care. Occupational hazards, workers in low paying jobs may be exposed to the hazardous conditions without proper proactive measures. So health exposures can lead to broad spectrums of health problems which can be categorized into acute and chronic effects. Like the specific health outcomes depend on the type, duration, intensity of the exposure as well as individual factors such as age, genetics and overall health. So let us have example like acute health effects. For example, short term exposure. This can lead to the immediate health effects such as respiratory stress, distress, skin irritations and poisoning. And we have another factor like infection disease, infectious disease. Acute exposure to the pathogens can lead to rapid onset of illness such as influenza, food poisoning and gastrointestinal like chronic health effects we have like in the chronic basically it is a long term. So chronic exposure means long-term exposure, prolonged exposure to hazardous substance or conditions that lead to chronic disease, like cumulative effects. For example, in repeated exposure to low levels of a toxin or such as lead, asbestos, it can accumulate in the body over time, like leading to serious health problems like cognitive impairments of mesothelioma, pathways of health exposure. Also we have like inhalation of breathing in airborne pollutants, gases or infection agents. So some, for example, inhalation of tobacco, smoke or polluted air can lead to respiratory disease, like different types of respiratory disease we have because of that. So like injection, consuming contaminated food or water, for instance injecting or ingesting like water contaminated with heavy metals can cause poisoning. Okay. Then dermal contact, like absorptions of chemicals or pathogens through the skin. Workers handling like chemicals without protective gloves may experience skin infections. Okay. So then we have like different types of direct introductions of substance into the body, often through medical procedures or drug use. So also that is also another factor, like health outcomes exposure, like acute effects, for example immediate health effects that occur shortly after exposure, such as burns, poisoning or allergic reactions, and that needs also proper within a time span. So chronic effects like long-term health effects that develop over time due to prolonged or repeated exposure, such as cancer, chronic respiratory disease or neurological disorders. So then we have also mental health effects like stress, anxiety and depressions related to environmental and socio-economic exposures, such as living in high crime areas or experiencing workplace discriminations. And that we have another factors like indicator of health exposures, like indicators are metrics used to assess the extent of exposure and its potential impact on health. And these include like environmental, biological and epidemiological indicators. Okay. The first factor is environmental, let us say. So then within environmental, indicators are like air quality index. So the how air quality index is very serious for the health. So if increasing air quality, that means high level air quality like more than 300, 400, as like in Delhi we have serious problems, different types of disease. Then water quality indexes. So water quality is how to measure the water contaminations, like whether it is increasing like different types of also like contamination of arsenic and all this. So COD, BOD we have also measure on water quality index, like soil contamination levels, like biomarkers. So that is also one are factors. So then we have like within that like biological indicators that reflect the exposure to specific agents measured through like different types of blood, urine or tissue samples. So examples are like blood lead levels used to assess exposure to lead particles, particularly in children, and a high level that can cause cognitive impairment. And another factor is like mercury level in hairs, indicative of long term exposure to the mercury, often due to consumption of contaminated like fish, for example. The epidemiological indicators, another factor, like incidence rates, the number of new cases of disease in a population over a specific period. High incidence rates of respiratory disease, for example, may indicate significant air exposure, pollution exposures. Then prevalence rate, like the total number of causes of disease in a population at a given time. For example, high prevalence of conditions like asthma may reflect ongoing exposure to allergens or pollutants. So vulnerability to health exposure, like vulnerability refers to the degree to which individuals or populations are susceptible to harm exposures from exposures. Okay. So then there is a factor like demographic factor, for example age, gender, ethnicity, and these can affect vulnerability. For example, children and the elderly may be more vulnerable to environmental toxics. So then we have also socio-economic factors like income as a factor. So then education and occupational influence access to the resource that can also mitigate exposure risk. So lower socio-economic status often correlates with higher exposures, and poorer health outcomes. So, we have also like another like health status, for example pre-existing health conditions such as chronic disease can increase vulnerability to additional exposures. Okay. Then environmental factors like living conditions such as housing quality and geographical locations play a role to the exposure level and vulnerability. Then health vulnerability, for example, refers to the degree to which the individuals or populations are susceptible to harm exposure like in the various types of health risk. Then another factor which is vulnerability is not uniform everywhere. It varies across different populations and individuals due to a range of factors such as age, gender, socioeconomic status, health status and environmental conditions. So, understanding health vulnerability is critical for identifying those at greatest risk and for developing targeted interventions to reduce health disparities. So, we have like different diversities we have in India, like income diversity, that also impacts that. Then indicators of health vulnerability, like indicators of health vulnerability are matrices or variables that help in assessing the level of susceptibility of a population or individual to the health risk. These indicators can be grouped into several categories, and within that we have demographic indicators. Age, elderly people and young children are generally more vulnerable due to weaker immunity systems or developmental stages. Then we have gender, for example women may be more vulnerable to certain health risks such as maternal health issues, while men may face higher risk for conditions like heart disease. So, similarly we have like socioeconomic indicators like income, for example low income individuals often have limited access to the health care, healthy foods and also safe living conditions. So, that increases their vulnerability. Then another factor which is very important, that is education. Lack of education can reduce awareness of health risk and access to the health promoting behaviors. So, health status indicators like chronic disease, for example individuals with pre-existing conditions such as diabetes, asthma or cardiovascular disease are more vulnerable to the additional health risk. And nutritional status, malnutrition can increase the vulnerability to infections and other health issues. Then we have another very important factor which is like environmental indicators. For example, environmental indicators like living conditions, for example poor housing quality, lack of clean water and exposure to pollutants can increase health vulnerability. So, then geographical locations also play an important role, like living in the areas prone to natural disasters or high level of pollution can elevate vulnerability. Then we have another socio and community indicators like social support networks. Lack of strong social networks can increase vulnerability by reducing access to resource and support during health crisis. So, then access to the health care is also very important, because if population will not be like with limited access to the health care, have serious impact on vulnerability. Services are more vulnerable to adverse health outcomes. There are several approaches to calculating the health vulnerability, ranging from qualitative assessment to complex quantitative models like composite vulnerability indexes, for example like social vulnerability index, and like poverty, access to transportation and housing conditions within that. Then we have health vulnerability indices like such as demographic, socioeconomic, environmental and health status data to access overall vulnerability. Then within that we have to some like mathematical models, for example risk assessment models, and then risk assessment models like how the exposure sensitivity and adaptive capacity within the risk factors. Then among that also we have another factor models is that it is a probabilistic model. Probabilistic model, within that also like we have for example statistical approaches like principal component analysis, and we have principal component analysis can be used to construct vulnerability indices by combining multiple indicators into a single measures. Okay. Then we have also another factors which we can use often, that is regression analysis used to identify the relationship between health outcomes and vulnerability factors, and also GIS based vulnerability assessment like applying remote sensing and GIS systems, mostly like geographical information systems. GIS can be used to map and analyze the spatial distribution of the healthcare vulnerability. And spatial analysis like spatial statistical methods such as spatial autocorrelations or hotspots analysis can identify clusters of high vulnerability and guide targeted interventions. Okay. And mitigation, prevention of health exposures like addressing the health exposure requires a multifaceted approach involving public health interventions. So, public like changes and also individual actions. Let us think about how the regulations and policy, how it works, and within that also we have like environmental regulations, like how governments can enforce regulations to limit emissions of pollutants like in polluted area. For example, reduce the use of harmful chemicals and use of safe drinking water. Then another factor which is workplace safety standards, like implementing and enforcing safety standards in workplace can reduce occupational exposures to physical, chemical and biological hazards. Okay. So, and also public health interventions. Within the public health interventions, we have vaccination programs. For example, vaccines can prevent disease caused by certain biological exposures such as influenza, measles and also HPV. So, and these HPV also included within the vaccination system of Government of India. Then health educations like raising awareness about the risk associated with the different exposures and also promoting protective behaviors such as using like sunscreens, wearing protective gears or avoiding smoking. Then community and individual actions like improving indoor air quality, like you have using like air purifiers, ventilating homes and reducing the use of indoor pollutants. For example, tobacco smoke can mitigate exposure to the harmful airborne substances. Okay. Then how the lifestyle, healthy lifestyle choices also very important, like adopting a balanced diet always, every day, from breakfast to dinner, regular exercise and avoiding harmful substances. For example, tobacco, excessive alcohol can strengthen like the body resilience against the exposures. Monitoring and surveillance, for example, within monitoring surveillance we have environmental monitoring systems like regulating for air, water, soil quality can help detect and address the harmful exposures before they lead to widespread health problems. Okay. So, within the health surveillance we have tracking the incidence of disease and health conditions can help identify the emerging risk and target interventions to vulnerable populations. Okay. So, when we are talking about this like in the all these factors, then we have conclusion like the how these factors are very serious about this like exposures, health and vulnerability. When we are doing with this like safeguarding public health and reducing the burden of disease. For example, if we will deal with like different types of risk and vulnerability and how to identify this risk, when we are identifying certain disease, when we are identifying certain vulnerabilities and what are the risks and what are the exposures. For example, workplace exposure and exposure to the like different age groups, different demographic structures we have, different age groups we have. So, all these factors when they are create like more accessibility to the risk to the exposures, it depends upon various factors, and within that factors population or demographic shift is also one factor, environment factor is also another factor, and also we have what type of lifestyle we have, that is also enhance the risk factors and vulnerability. So, if we can identify and analyze the various physical, chemical, biological and socioeconomic factors for exposures. For example, physical exposures, place, location is also very important, like geographical location of a place that has significant or like risk factor or vulnerability, like those who are living in the mountainous areas, they are very prone to some types of like hazards. So, that also have some impact on their risk and vulnerability added to that. and we have chemical like vulnerability or risk. Those who are having exposure to the chemical industries or chemical places, living where nearby there is a chemical industry or any like waste is coming, chemical waste are coming, they are getting the exposures. And also biological exposures we have, and also similarly we have socio-economic exposures, like different age groups, different inequalities within the income levels, and we have different strata of the society, social level. So socio-economic factor and exposure also very important. Within the socio-economic, as we have said, like literacy, for example, education, access to education is very necessary, otherwise they will be not aware about what type of medical facilities or policies or programs are there, so that they can able to have maintain their health standards. So also we have problems of like water quality, air quality. So all the environmental problems we have. So all these factors are very important, and that factors also add to the vulnerability, exposure to the vulnerability. Once you expose, then means risk of vulnerability is high, and it is very effect, and it has serious impact on the different age groups, different strata of the society, different parts of the society. So it has spatio-temporal, like sometimes it is a short term, sometimes it is a long term impact. So when exposure is there, like for example physical or chemical or biological, we have also with that the vulnerability linked with this exposure, that becomes very serious. Okay. Then we have like another factors, like we have how this if we say like exposures, we can have better understanding of like anticipate of acute and long term or chronic health effects. For example, we have some acute problems, and chronic means when it is long term, tuberculosis, cancer, yes. And if we are using like pesticides using in agriculture field, that added to the like it's a chronic health problems of cancer, like cases of in the western Punjab belt, we have a problem of more cases of cancers are coming because of use of excessive pesticides in the agriculture practice systems. So that is exposure they are getting. So the application of diverse methods and tools such as composite vulnerability indexes, statistical models, and geographical information systems, and like they are enhance the our ability to accurately access and address these health risks. Okay. So I hope from this lecture learners have learned a lot of things, how to define the different types of vulnerability, what are the different types of exposure, and how this exposure are linked with the vulnerability, with like we have different types of exposure, different types of vulnerability. Within that, when we have integrated systems and coming to an having a comprehensive integrated systems to understand risk and vulnerability, we will also in the next lecture will tell in detail what is the area, what type of disease are there, which area is vulnerable, and how we have the indices of vulnerability. So I think on the last also we have some like references, books, and you can go through that. And thank you all for listening this lecture, and I hope you will better understand this subject of risk and vulnerability. Thank you.